Majority of people completing addiction treatment resume alcohol and drug use in the next 12 months. Of those people who do that in 12 months, most of them will do that in the first 90 days. Of those who return to alcohol and drug use in the first 90 days, listen to this figure. Of all the people who relapse, all the people who will ever relapse following an episode of addiction treatment, called an index episode. So if I take 100 people or 1,000 people, and we take this admission, and we study all those people who will ever relapse after their discharge from this one episode of treatment, and we look at all of those who relapsed, between 80% and sometimes even as high as 90% of those will do so in the first 90 days. Is that an amazing figure? Did everybody hear what I just said? Of all the people who will ever relapse, when you tell them goodbye, 80% will do so in the first 90 days. Now, if there was any other medical condition that we knew the time of greatest vulnerability for relapse and reoccurrence of that condition was in the first 90 days, how aggressive do you think we'd be monitoring it? Absolutely. I mean, we would be there with them, right? I mean, we're going to be checking on them and checking on them. Yeah, this number 90 keeps coming up. We've got this sophisticated research. We spent $1 billion to tell you what an AA old-timer would tell you with a 5th grade education. 90 days. What's this tell us? I want you to think about tomorrow. We're going to talk about shrinking resources tomorrow. If you got little resources to apply to redesigning what you do, and you got a little bit of resource to apply here in terms of post-treatment monitoring and support, when do you want to saturate those resources? Right here. What's it tell you? From the normal time we disengage and tell people goodbye, and by the way, try to get back for a continuing care group, start the clock ticking and saturate those 90 days. Okay, for our adolescents, this is the Cannabis Youth Treatment Study. 600 adolescents randomly assigned to the best outpatient treatment this country has to offer. This is 1-year follow-up data. If we want continuous, uninterrupted sobriety, that is the green piece of the pie. Of 600 adolescents, we have 12 adolescents, a little less than that actually, that have maintained continuous, uninterrupted sobriety. 40%, we have no measurable effects of the intervention. Meaning that post-treatment drug use is no different than pre-treatment drug use. But look at these other groups. So about half, by the way, if we think treatment works or doesn't work, we got about half. Now, this group here are in and out of recovery, in and out of problems, but they're spending more time experiencing problems than they are in stable recovery in the first 12 months. This next pie up is intermittent, 7%, but they're actually spending considerable time in recovery during that first year. The next group is later sustained recovery. This is a fascinating group. This is a group that clinically deteriorated almost immediately after treatment. I mean, they were high within minutes of discharge in some cases. And we thought, oh man, broke our hearts. Treatment failures. So the early outcomes looked horrible. But when we got out to 3 months and 6 months, and particularly 9 months and 12 months, what do you think we found? Nice recovery effects. This is a typical adolescent recovery pattern, not unusual at all. Because I don't care what we taught the adolescent, cognitively, how do they learn? They learn behaviorally. And we have given them a set of knowledge that principles they now have to test out. And if their experience confirms what we shared with them, what happens? As the consequences reoccur, right? They kind of get these aha moments and personalize that and then migrate back into long-term recovery. Yeah, this is David's raising this question. Yeah, David's raising this question. First, was this an effect of treatment, or is part of this 9% kids who were lower problem severity who would have got well on their own. I mean, that's a possibility. And we don't know that, but here's what we do know. We tried 5 different therapies. 600 kids were randomized to these different outpatient therapies. We found effects in all of them, meaning the kids who got treatment did better than some control group kids who didn't get treatment. But when we compared the individual treatments, like with Project Match, what do you think we found? Almost no differences. Almost no differences. So, my point is, in our adult and adolescent studies, if we followed your program, I would predict this. We will find people who are your superstars. Sustained, uninterrupted recovery from the day they were discharged from your program. And we ought to celebrate those. Those people do well and have transformed their lives. And we are thankful for that.